My name is Hoyne. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and I'd like to continue our series on mental health explained, or at the moment bipolar disorder explained. And before we continue on to a bipolar disorder, the one thing we really have to look at is what is a manic episode. So today I talk about a manic episode. In principle, it's an episode of abnormality and continuously elated mood. People can be expansive, irritable, and they have to have a couple of symptoms to qualify for the full diagnosis. So, on top of this, one episode should last at least a week, and it very often leads to admission to hospital, and its disturbance must be severe enough to impair the occupational or social functioning. Mental health problems such as psychiatric features may also be involved. So what are the clinical main features? It's elevated mood, completely out of the norm, increased energy, which might be overactivity, reduced need for sleep. There might be a formal thought disorder. We come to the definition of formal thought disorder, but here we mean that people are not thinking in the usual way, and it might be that there's pressurized speech. People are talking more than they need to, and the way they talk can be very disturbing to others. So in this respect, it can be quite disturbing for the patient, but also for the relatives. Very often it's relatives who bring the patient to the hospital. So the other thing, what we call formal thought disorder, is flight of ideas, that people can go from one point to the next, and that means that they can pick one item or one word and tell a story about that. Then there's another word and it's a new story, and these thoughts can be racing. Very often the self-esteem is increased. People feel they're billionaires. They're very optimistic. Some grandiosities may be there. So they might feel they're religious leaders, or have at the moment what I recently saw, immense wealth or followers on the internet and being famous. They have reduced social inhibitions. That means they would talk to people they would never talk in other ways. They can be very familiar, and some people might fall in love with the first sight of something, some person. The attention is reduced, so if you talk to them, it might be very difficult. They might be very distractible. They might, engage in behavior that has very severe consequences. It might be people buy things they have never bought or never needed. Might be cars in people who haven't got a driving license, and very often themselves or the family goes into debts for that, or at least they struggle very much to get the sales or the purchase returned. That's what we call reckless spending. There might be inappropriate sexual encounters, which they would never do in other circumstances. Extreme excitement about possibilities. Aggression might be a problem. Extreme suspiciousness on other people. And as you might expect, then the work will be disrupted, and family life might become a very difficult disaster. In the more severe form, there might be psychotic symptoms, that people feel they're grandiose, as I mentioned, being religious leaders, having superpowers, being able to fly. And even if you don't believe it, that's something I recently encountered, where a patient thought she would be able to fly. Never seen it, but she didn't. She was very convincing she could. Then people might have ideas of prosecution, delusions of other people being unfriendly or adversive to them or following them. and might be in love with them, even though these people never have seen them. So there's nothing unusual if a patient with mania would tell you that a famous singer is in love with them. I must admit I had a patient who was from the Asian community and was really happy to convince us that she would be the daughter of Prince, or now King Charles. Right, flight of ideas, pressured thoughts, I said this already, irritability, aggression, which might be leading to violent behavior. Very often the violent behavior isn't caused by the patient, but by others who are not able to deal with the continuous manic behavior. There might be extreme self-neglect, that people think they don't need to eat or drink anymore, and at some point in time people might come into a stupor that they don't move at all. There's complete loss of insight. Sometimes people have some insight, and if they have insight, you can be very lucky, because people then might be amenable to treatment. Even though that the mood is elated, very often people don't like this feeling because it's very stressful and exhausting. So even people have manic episodes, they sometimes would prefer to have depressive episodes, which are part of bipolar disorder, simply because the stress of this elevation and the problems which are related to that can be very negatively perceived. So there's other diagnoses which might be seen as overlapping or being a differential diagnosis, which is schizoaffective disorder, schizophrenia, PTSD, anxiety disorder. ADHD is a candidate, or alcohol and drug abuse, because very often people who have mania, they don't need to sleep. They might take drugs, drink excessive amount of alcohols, and they use stimulants, which again can make the disease more severe. There might be some physical health problems, or especially brain disorders, which might cause the manic symptoms. But in this respect, it's a question whether this is a genuine mania or whether the symptoms are induced by the physical health problems such as MS, HIV, or other mental disorders. I personally would say I would prefer to take the clinical assessment for a diagnosis of mania, and if the mania is caused by physical health problems, so be it, and this then can be treated. I talked about the medication, which might be a problem inducing that, but I come to that later. What you need to do in general, we come to that in another video. Risk assessment, make sure people are safe, calm down as much as you can, look at stressors and try to avoid them, and in case, very often, if it's very bad, hospitalization is needed. Certainly psychiatric care would be needed. And I don't want to extend it too much today. I wish you a nice day. If you like our videos, please subscribe to Global Psychiatry Archives. And if you're interested, you can also put your own video on our website, as long as it's educational and supportive to mental health patients. I wish you well and have a nice day.